Dr. Mohammed Munir. Dr. Munir, thank you for talking to us. Yet again, it seems inevitable that it was the public's fault.
Oh, yes, absolutely. I think public support has to be there. Without having public support, this pandemic cannot be controlled. And I think public trust and having clarity in the messages from the government and also from the scientific community is really key to drive this initiative further, to really tackle down onto the infection rate. Absolutely.
Well, seriously though, if you tell people a lockdown is coming, they will go out and try to have one last night out on the town, won't they?
I think one of the major contributing factor into the number of cases that we are seeing now is really those 4 or 5 days. 31st of October, when it was announced that lockdown will be coming, and it was implemented on 5th of November. So those days were really partying days. I mean, I'm one of the member of the society, and I can really see around that how much rule has been really flouted during those time. And I think even anything that you propose before that is going to be contributing factor.
Indeed. The trouble is though, how do we stop that?
Well, I think that is really, again, the responsibility of the government. That, I mean, we are into this pandemic for 10 months, and I think we know how is the public attitude toward. There is no need to announce any restrictions or the control measure to be put in place a week before or even 4 or 5 days before. What I mean to say is that unless we have this really bang on to this pandemic, literally we are not going to see any positive impact. For example, looking on to the current restrictions that are currently in place, we know that the whole country is on to hold, but still we are not seeing any benefit, and that is really because the virus doesn't knock the door. All it does is that we go out and bring the virus back.
Well, the SAGE papers that we heard about there, about a stricter tiered system after the end of lockdown in England, I mean, it hardly seems like lifting lockdown at all, does it?
No, well, as it stands now, I don't think that rest of the 3 weeks we're going to be contributing that significant level that we will be confident enough to put the lockdown off. But I think important is that we stick with the rules, and the government provide the clear evidences where we are heading into. Altogether will have any impact, but otherwise doesn't seem to be having any significant impact onto the control of this infection.
The problem is though, if you tell people that we have a lockdown and then we're going to have a strict tier system, it looks like there's no end in sight. Psychologically though, people sort of give up a bit, don't they?
Oh, absolutely. I think that is one of the problem, that we are getting tired of the pandemic, but unfortunately virus is not getting tired of, and it would never be. It will keep fueling until it find naive population, until it find the population that can be infected. So I think this is us. We have to stick with the rules.
Finally then, just to wrap up, I mean, we've had massive rises in cases, slightly fewer today, as our correspondent was saying, but even so, lockdown isn't working yet, is it?
No, I don't think so. As it stands now, I don't think the lockdown is working, and within 1 week, I don't think that we should anticipate it would have a massive impact. And as is the case with the next 3 weeks, I would be extremely surprised if it would have a significant impact onto the infection rate going down. And even if go down, and if we are not gonna obey by and now pharmaceutical intervention are not being put in place at the level that it should be, we will start seeing the cases coming back again very quickly.
Dr. Mohammed Munir, thank you very much indeed. Well, meanwhile, NHS